This 61-year-old restaurant owner was referred for upper endoscopy to evaluate long-standing typical dyspepsia and reflux-type symptoms. His upper endoscopy appeared quite normal, except for what initially appeared to be a wisp of mucin floating in the gastric fundus. On closer inspection, this worm-like structure was seen and identified as the marine parasite Anisakis simplex, which is the cause of anisakiasis. The life cycle of Anisakis starts when eggs produced by adult females are passed in the feces of infected marine mammals. They hatch and molt through several larval stages before being consumed by crustaceans, their first host. Following further maturation, the larvae become infective to fish and squid when consumed. Once in marine hosts such as tuna or cod, the larvae are infective when consumed by either marine mammals or humans. If the host dies, the larvae migrate to the muscle tissues where, through predation, they will pass on to another host. If instead they are consumed by marine mammals, they will mature in the host's intestine to shed eggs as adults. Humans become incidental hosts when they consume raw fish, often in the form of sushi. The larvae hook into the gastric or intestinal wall and can cause a significant localized reaction, and in some cases peripheral eosinophilia. Most often the clinical course following ingestion is asymptomatic, the larva briefly anchoring to the gastric or intestinal wall before dying and passing uneventfully. Larvae had been reported to penetrate the gastric mucosa and cause abdominal pain and vomiting. Small bowel lesions mimicking Crohn's disease have been noted. When seen endoscopically, removal, as demonstrated in this case, is curative. Generally, medical therapy is not necessary, but limited experience with albendazole has been reported.